Good Friday, everyone, and welcome to this edition of Conversations Daily News. I'm your host, Cyrus Webb. Glad you all could join us once again. Well, we made it to the end of another week. We, of course, have your news headlines coming up today. We have the Truth of the Day with Mary Ellen Ciganovich, and today in Entertainment Spotlight, you're being part of my conversation with Daryl Means. Daryl is the Northwest Regional Administrator at the Centers for Medicare and Medicaid Services. He's going to talk to you guys about what you need to know about the upcoming open enrollment period for healthcare. Enjoy today's program. For Conversations Daily News, I'm Cyrus Webb with your Friday headlines. In national news, COVID-19 in Mississippi, tracking cases, deaths, and latest restrictions. There were 172 new COVID-19 hospital admissions and 1,166 current COVID-19 cases in the state, both of which set new records, according to State Health Officer Dr. Thomas Dobbs. Dobbs said the pressure in ICUs in the state is worse than during the COVID-19 summer surge. He said 26 Mississippi hospitals are on diversion for critically ill patients. Expect more efforts soon to enhance access to care, Dobbs said on Twitter. The Mississippi State Department of Health reported 2,283 new COVID-19 cases in Mississippi and 42 additional deaths on Thursday. There have now been 4,083 coronavirus-related deaths in the Magnolia State since March, and 172,955 COVID-19 cases as well. Around the country, more than 14.7 million Americans have been infected by the coronavirus, and at least 282,000 have died, according to the Johns Hopkins University study on Thursday. After the first cases of COVID-19 were confirmed in the U.S. on January the 20th, it took almost 100 days to reach 1 million infections. Now the country has added more than 1 million cases to its grim total in just 5 days. From Tuesday to Saturday of last week, 1 million new coronavirus cases were reported in the United States. In a related story, Ellen DeGeneres says she is positive for COVID-19. Daytime talk show host Ellen DeGeneres says she has tested positive for COVID. In a memo posted to her TV show's verified Twitter account, DeGeneres says she is feeling fine right now and that anyone who has been in close contact with her has been notified. DeGeneres' talk show welcomed back live audiences in October, though they were limited and required masks. Audiences were held to 40 people, and in addition to keeping a social distance and wearing masks, attendees also had to pass health screenings. USA Today reported the show's production will be on pause until January. In more COVID-19 news, U.S. experts convened to decide whether to okay Pfizer Vaccine. A U.S. government advisory panel convened on Thursday to decide whether to endorse large-scale use of Pfizer's COVID-19 vaccine to help conquer the outbreak that has killed close to 300,000 Americans. The meeting of outside advisors to the Food and Drug Administration represented the next-to-last hurdle before the expected start of the biggest vaccination campaign in U.S. history. Depending on how fast the FDA signs off on the panel's recommendation, shots could begin within days. In more national news, under the rug, sexual misconduct shakes FBI's senior ranks. An Associated Press investigation has identified at least 6 sexual misconduct allegations involving senior FBI officials over the past 5 years, including 2 new claims brought this week by women who say they were sexually assaulted by ranking agents. Each of the accused FBI officials appears to have avoided discipline, the Associated Press found, and several were quietly transferred or retired, keeping their full pensions and benefits even when probes substantiated the sexual misconduct claims against them. Beyond that, federal law enforcement officials are afforded anonymity even after the disciplinary process runs its course, allowing them to land on their feet in the private sector or even remain in law enforcement. They're sweeping it under the rug, said a former FBI analyst who alleges in a new federal lawsuit that a supervisory special agent groped her at a colleague's farewell party in 2017. She ended up leaving the FBI and has been diagnosed with post-traumatic stress disorder. In business news, fears and tensions mount for commuters still heading to work. As the coronavirus rages across the U.S., grocery workers, healthcare professionals, university staffers, cleaning crews, and others who don't have the option to work from home must weigh safety against affordability when deciding how best to commute to their jobs. Those who have ditched public transportation and drive to work instead contributing to a boom in used car sales in the U.S., which spiked to their highest level on record in June, according to Edmunds. Meanwhile, public transit agencies have seen ridership plummet, not only because of all the people opting for cars, but also so many are now working from home or have lost their jobs altogether. And finally, in entertainment news, Taylor Swift surprises fans with another album out today. Taylor Swift fans are getting a double reason to celebrate this year. The singer-songwriter releases her second album in 2020. To put it plainly, we just couldn't stop writing songs. Swift wrote in social media posts Thursday morning, "I've never done this before. In the past, I've always treated albums as one-off eras and moved on to planning the next one after an album was released." Cyrus Webb, Conversations Daily News. It's now time for the Truth of the Day with Mary Ellen Ciganovich. Enjoy.
Hi, this is Mary Ellen with your Truth of the Day. Go with the flow of life. Release your attachment to the outcome of any stressful situation. Allow yourself to focus on the now moment as you go with the flow of life. Anxiety can cause you to tense up and resist the flow of life. You can relax as you inhale and exhale, utilizing deep breathing techniques. This will help you learn how to use your energy as you allow the universe and God to work through you. Nervous energy can be the result of stress and work obligations. You can choose to focus on the task at hand rather than the outcome. Release your anxious hold and stop fighting against the current of life. Today, release your anxious hold on anything. Stop fighting against the current and have more energy for today. As you always, enjoy the day.
Daryl Means is featured in today's Entertainment Spotlight. Enjoy this helpful information here on Conversations Daily News. For Conversations Daily News, I'm Cyrus Webb with the Entertainment Spotlight. Daryl Means at the Centers for Medicare and Medicaid Services joined me on Conversations Live, the radio show, to talk about this year's healthcare open enrollment period with some information you need to know. Here's a bit of our conversation. Well, we have been letting our audience know, of course, about this open enrollment period. But, Daryl, when is the deadline, though, for them to be able to sign up for 2021?
Cyrus, this year's health insurance marketplace open enrollment is almost over, as you stated. You only have until December 15th to shop for a 2021 health plan.
As I mentioned, Daryl, and we've been talking about this over the past couple of months as we've been trying to remind our audience, there are some people out there who, of course, say, you know what, health insurance is too expensive. Others may say, you know, I'm already in a plan. Why should they take a look, though, Daryl, as to what's available to them now for 2021?
Well, first of all, they should take a look because things change. Even though they may already be in a plan, they can go into healthcare.gov and check to make sure, one, that all their information is up to date. Two, they can browse through to see if there's a better plan that meets their needs because their health changes and their plans changes and providers change. You also mentioned about the cost of it, and what we're seeing in Mississippi is that the premiums in some cases are dropping as much as 6% this year.
Wow. Wow, that is great to know for our listening audience, for sure. Daryl, the other thing that I noticed when I was prepping for this segment, and I think it comes up a lot, especially because of COVID, is another incentive that you all have been really pushing for people to check is because of now the increase in telehealth. I know I've been taking care of that now with my family. Is that something also you're noticing people are wondering if their plan covers that, and if not, what plans do?
Well, if nothing else, COVID has highlighted the need for folks to really check their plans and make sure their plans cover them and cover the help that they need. So it's important that folks go into healthcare.gov and check to see what's available to them and update their information so that they are getting the best plan for their healthcare needs.
Cyrus Webb, Conversations Daily News. We thank you all for tuning in to this edition of Conversations Daily News. We'll be back with you guys on Monday with more news, Truth of the Day with Mary Ellen Ciganovich, and of course your Entertainment Spotlight. Until then, I'm your host Cyrus Webb saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Daily News today. Let's make it a great one.